So let's try and work out what exactly is happening with the Health Secretary, Matt Hancock, who joins us from central London. Good morning to you.
Good morning.
On the quarantine position, should we start with that? It's currently 14 days. Is it being changed to 10?
Well, we are looking at what we can do on that front with the use of testing, but we'll only make any changes if they are safe to do so. And at the moment, for now, the position remains as it is, which
Mm.
is that if you have to quarantine because you've been to a country that is at risk, where the rates of coronavirus are too high, then you have to quarantine for 14 days. But there's lots of proposals that have been put out for how that could be reduced, and we're working with those and seeing what can happen, but there is no imminent change to that that's being proposed.
I'm just interested in the kind of science behind it because it
Yeah,
seemed quite an immovable number for a long time. 14 days, which obviously is a lot for people to do if they are coming back and they want to go back to work. Other countries, I think it's Qatar, test sooner. I think it's like the seventh or the eighth day, and therefore they don't have this 14-day quarantining situation. So what does the science say on this? Is it possible to test earlier?
well, the science says that there is the possibility of infection because it's all about how long somebody incubates the virus for. It's
Mm.
all about the period in which the virus can incubate within you without presenting itself. So the working out whether you can do a test at that sort of period, and then that will reduce the means that you reduce the risk, you minimize the risk. That is a essentially scientific question, and we are doing the work to find out if using testing it could be safe to take that approach.
Mm.
So it is something that we're looking at, but it isn't something that we're yet able to conclude on, and therefore the rules stay as they are.
Right. What is the science on potentially changing the isolation rules if I develop coronavirus symptoms? Because it was 7 and you're thinking
Yes.
of putting it up to 10. So, what's the science there?
So the chief medical officer is going to set out more about this later today, but that is about how long after you've shown symptoms you might still be able to transmit the virus. On that, obviously, we're guided by the science, but also I want to take a precautionary approach because we can see a second wave in parts of Europe, and we want to make sure that we do everything we possibly can to protect this country from it. The number of people in this country who are testing positive is now much, much lower than it was at the peak, and we want to make sure that we take that cautious precautionary approach. And if the science improves and strengthens, and the judgment and the advice from the scientists changes, that of course we'll be guided by that.
I suppose it depends which scientists, and that's been a feature of this pandemic throughout this pandemic.
Yeah,
In the WHO have been advising that it should be 10 days for isolation for a long time.
yes, of course. There's lots of different scientific voices, and the process we have, famously, is that we take those all into account. We listen to them, including through SAGE, and then the advice that comes to ministers comes from the chief scientific office advisor and the chief medical officer. This is clearly a clinical decision, so the scientific advice comes from the chief medical officer. He's also working with the chief medical officers in Scotland, Wales, and Northern Ireland, and they'll be making they'll be talking later today about
Mm.
exactly what the judgment is here. But you can see that from my point of view as health secretary, I'll be guided by the science, and we don't follow it blindly, but we are guided by it. And in this case, I want to follow the scientific advice very, very closely.
Right. Speaking of scientists, I must ask you about what Patrick Vallance has been saying, apparently, that we're 2 to 3 weeks behind Spain. Is that true? Is that what he thinks? Is that what you think?
Well, what I'd say is that there is clearly a second wave that is rolling across Europe, and we need to do everything we can to prevent it coming to these shores. We've seen the case rate in Spain go up sharply. That's why we had to take the action that we did. We moved fast on Spain, and I'm very glad we did. Since we've took the action that we did, the case rate has continued to rise, and we need to make sure that we protect everybody in this country from the virus coming back again from Europe as it did in March. So we've got to take that action. Now, I've been in many meetings with Sir Patrick, but I haven't heard him say what he's reported to have said. But what I know for sure is that there is a rise in the number of cases in many parts of Europe, and we've got to protect this country against it.
Are you a voice of restraint then, Matt Hancock, in government? Because the government's still saying we should all be coming back next week into our offices. And actually, you're saying you're cautious, you're worried about a surge. Do you think we might need to change that policy, get people safer at home, because that's more pressing than the economy at the moment?
Well, I follow the data, and the data has changed in the last couple of weeks. When we brought in the exemption for travel to many European countries, the exemption from the quarantine, that exemption was because their number of cases was really very, very low, and lower than in the UK. And in some European countries, that's changed. And you'll remember when we brought in the exemptions, Portugal was, many people said, but what about Portugal? That isn't included. At the time, Spain's case rate was really quite low, and it rose very sharply in the last 2 weeks, and that's why we had to take the action that we did.
So if the data changes in terms of domestically, people going back to their offices is giving you concern, you would recommend that we work from home again?
Well, we've been clear all along that we keep all these things under review. And I think, some of the response to the decision that we took and had to take rapidly on Spain, of people saying, well, we didn't know that this might be coming. The truth is, with this virus, you have to follow the data. You have to look what is happening, and then you have to make decisions based on that. And when the facts change, then we change their decisions. And so we're always looking at the data, and we're always looking at the policies that we need to try to guide this country through. It's not straightforward because the virus is not straightforward to deal with.
Let me ask you finally, it's a two-part question really. First of all, the NHS People Plan is about kind of cutting administration. Can you explain what kind of bureaucracy and administration that is? And also, I'm sure you'll be aware that a new poll has shown that 85% of the public think that NHS staff should receive a pay rise. Now, I know that there may already be a pay rise on the cards, but this is something else. So would you support that?
Yeah, so the NHS People Plan is all about how we can empower NHS staff on the front line who've done so much, and especially during the peak, they enjoyed a lot of flexibility. They didn't, they worked incredibly hard, and we removed a whole series of rules and bureaucracy that previously had stood in their way. And the speech that I'm giving later and the people plan that the NHS has produced is all about how we can bottle the things that went well. Now, enormous sacrifices were made, and it was an incredible challenge. But how do we bottle the things that went well? And the people plan is about making sure that the 1.3 million people who work in the NHS on the front line are empowered to work to the best of their capabilities, and there's a whole series of things that we can do to make that happen. And the speech that I'm giving is all about how we bottle the things in the NHS that went well, that helped to protect us.
And the
On
pay?
the pay question, there is an existing 3-year pay deal for nurses, and that's which is agreed. And of course, there'll come a time to look at that again, but that 3-year pay deal is.
But you're going to give them more.
So nurses have just got a pay rise, and they are getting a pay rise.
And you'll give them a pay rise when that pay deal comes to an end. It seems extraordinary to say you'll pay all these other public sector workers, and you won't in November give nurses a pay rise as well.
Well, it's not about November because this runs for longer than that. But I will. But the nurses have, of course, there will come a time when we need to have that discussion, and I'm sure that we will. But I'm very glad that the generous 3-year pay deal that we're currently in with nurses means that they are well remunerated. And then, of course, for doctors, that's on an annual cycle. So we made the decision to increase doctors' pay earlier this month.
Matt Hancock, Health Secretary, thank you very much for talking to Times Radio.